Hello students, I am Dr. Barkha Bhoneja, Senior Lecturer, Department of Prosthodontics from BBD College of Dental Sciences, BBD University. So in the previous lecture of articulators, we had covered till minimal articulator requirements and additional articulator requirements and what is basically an articulator. So we'll continue further with our presentation and we will first go to classification of an articulator. So the Boucher in 1934 first classified articulators as non-adjustable, adjustable, semi-adjustable articulators. So non-adjustable, adjustable, semi-adjustable articulators, basically what is different? So difference in an articulator is the adjustable is how you see the recordings in the patient's of mouth. You can adjust that into the articulator to stimulate similar to that of your patient's mouth. So these are called as adjustable. Semi-adjustable, certain components can be adjusted, certain cannot. And non-adjustable, that they are made of an average value and these articulators recordings cannot be adjusted. Later at International Prosthodontic Workshop on Complete Denture Occlusion at the University of Michigan in 1972, an articulator classification was developed based on the instrument's function. Now, the classification is as follows. So, this international workshop, it classified articulators basically into four class of group. So, first class was simple holding instruments capable of accepting a single static registration. Vertical motion is possible, but only for the convenience. That is, the instrument is going to hold your maxillary and mandibular castes both into opening and closing axis of the. So just the horizontal movement of the articulator in this horizontal plane is possible. So not the lateral, not the protrusive. So all of these measurements cannot be recorded. So it is just a static registration of opening and closing. These are called as a class 1 articulators. Class 2 articulators are instruments that permit horizontal as well as vertical motion, but do not orient the motion to the temporomandibular joint via the phase-go transfer. That is, it can open and close, and to some extent you can do limited lateral and protrusive, but you cannot. So these articulators are basically set as an average or arbitrary values, so you cannot copy what is present in the patient's mouth. The values cannot be copied into the articulator, but they are already present into the articulator. Okay, so they can be classified as eccentric motion permitted based on average or arbitrary values that I've told you. So a large number of population, their condylar values, their incisive value, these were all calculated and they were programmed into the articulator. So therefore, they are called as an average or arbitrary value articulators. Eccentric motion permitted based on the theories of arbitrary motion. So basically, these are the articulators which are based on the theories. So there were a lot of theories of maxilla, how it is oriented to the skull and how is the mandible in relation to the maxilla. All of these theories, according to these theories, the articulators were fabricated. Or eccentric motion permitted determined by the patients is the engraving methods. That is, the engraved records we use to produce these articulators. Now, class 3 instruments that simulate condylar pathways by using average or mechanical equivalence for all or part of motion. These instruments allow for joint orientation of the cast via the phase-go transfer. So first we need to tell you that there are 5 records that can be taken from the patient. There can be centric relation record, that is the closing of the patient. The protrusive record, that is the anterior movement of the mandible. The lateral records, that is the side to side movement. Okay, there is a phase bow record that orients your maxilla to your base of the skull, and intercondylar distance, that is the distance between the two condyles. So these 5 records are basically which classify all the articulators. So in class 1 and class 2, there is no phase bow record, but there is centric relation record in class 1. There is centric relation record in class 2, as well as limited protrusive and lateral record, whereas in class 3 we take a phase bow transfer as well. So instruments, now class 3 also has class subtype 1 and type 2. So instruments that accept a static protrusive registration use equivalence for the rest of the motion, that is your class 1. So class 3 type 1. So type 1 will take a protrusive record. So you have to give a record in the patient's mouth, and you have to ask the patient to bite in the protrusive registration. That will give you a static protrusive registration, and use equivalence for the rest of the motion. Now this protrusive value, you have to put it into the articulator, and the lateral record can be calculated from the formula L is equals to 12 upon 8 plus 12. Okay, sorry, L is equals to H upon 8 plus 12. So instruments that accept static lateral protrusive registrations and use equivalence for the rest of the motion. So this is class 3 type 2, whereas the articulator not only takes up the protrusive registration for the patient, that it also takes up lateral protrusive registrations from the patient. That is, in class 3 type 1, we were calculating the lateral via a formula, whereas in class 3 type 2, these lateral records will be obtained from the patients, and these values which are obtained from the patients will be put onto the articulator. Class 4, instruments that will accept 3-dimensional dynamic registrations. These instruments allow for joint orientation of cast via a phase bow transfer. Now, class 4 will give you all 5 records. All 5 means the condylar centric relation, protrusive, lateral, intercondylar, and phase bow. So all of these values can be adjusted. Now these articulators will actually stimulate what is present in your mouth to the articulator. Another classification, now we are moving on to basically what is class 1. Instruments in this class accept a single occlusal interocclusal record. Vertical motion may or may not be possible. The first articulators were called as slab articulators. As you can see in the picture, only there is opening and closing movement present in the. So this joint where you can see the opening and closing happening is called as a hinge joint. So the hinge joint articulator is representative of this class. J.B. Garriott reportedly designed the first hinge articulator about 1805. Garriott's articulator, it was called, consisted of a single hinge with a set screw in the posterior against a metal plate to serve as a vertical. So can you see the diagram? It is a hinge articulator. That is class 1. Class 2A is instruments in this class permit eccentric motion. Eccentric means any motion which is other than your centric motion, based on average, and will not accept a phase bow transfer. So the most important point is not accept a phase bow transfer. These articulators are based on average values. Okay, the casts are mounted on these instruments according to Bonneville's triangle. Okay, what is Bonneville's triangle? Basically a equilateral triangle theory, where we put 4-inch line from the center point of the lower central incisors to both the condyles. So it forms an equilateral triangle. So this theory was mounted into an articulator. The most popular instrument of this class is the simplex, designed by Alfred Geissy of Gurek in 1914. The condyles are on the lower member and the condylar parts are inclined 30 degrees. The incisor guidance is fixed. Now, very important thing, the condyles are on the lower member. Okay, that means the condyle which is present in our mouth, In certain articulators, these condyles may be into the maxillary upper member of the articulator, whereas in certain, it may be present into the lower member. So the condyles here are present on the lower member. And the condylar path, that is when you see the articulator, the movement of the condyle occurring in this area is called as a condylar path, which is inclined averagely at 30 degrees, which is mostly present in most of the patients. So this has been average value that has been deprived. So the incisal guidance is fixed at 60 degree. Okay, this is class 2A. Class 2B's instruments in this class permit eccentric motions based on arbitrary theories of motion. Okay, so there is a theory which is called as a monsoons theory, which says the mandible moves with the respect to maxilla in an 8-inch circle with the center at gavilla. Okay, 8-inch diameter, that is 4-inch is a radius. So this you can see will be a rind presenting the movement of the, so this is monsoon's theory. So monsoon's instrument is based on its spheric theory of occlusion, in which each cusp and incisal edge conforms to a segment of the surface of a sphere, which is 8 inches in diameter, with its center at the glabellum. But that is for today. We will move on to the next slide, the next motion. Thank you.